In a land far away, there was a small village located in a remote corner of a developing country. The village had a population of around 500 people who were primarily engaged in farming and livestock rearing. One day, an outbreak of a deadly disease occurred in the village. The disease quickly spread among the villagers, and soon many people fell sick. The nearest hospital was located more than 100 kilometers away, and most villagers couldn't afford to travel there. The situation quickly turned into a crisis as there were no healthcare facilities in the village to provide medical assistance to the sick villagers. The few healthcare workers available were not equipped to handle the outbreak, and the situation became awful. Families watched helplessly as their loved ones succumbed to the disease, and the death toll continued to rise. The villagers were left feeling helpless and hopeless. It was then that a group of doctors and nurses from a neighboring town arrived to help the villagers. They set up a temporary medical camp in the village and started providing medical assistance to the sick villagers. They also started educating the villagers about the disease and how to prevent it. The medical team worked tirelessly for weeks, treating the sick and saving many lives. They also worked with the villagers to set up a local health center and trained local healthcare workers to ensure that the village had access to basic healthcare facilities. The villagers were grateful for the help they received, but they knew that their situation was not unique. They realized that millions of people around the world do not have access to affordable and accessible healthcare, and they knew that something needed to be done. The villagers began to advocate for better healthcare policies, and they urged their government to invest in healthcare infrastructure and make healthcare more affordable and accessible to all. They knew that a healthy population was essential for the development of their country and that healthcare was a fundamental human right. Their efforts paid off, and the government finally invested in healthcare infrastructure and set up affordable and accessible healthcare facilities across the country. The villagers continued to work with the government to ensure that healthcare was available to all, and they remained grateful for the doctors and nurses who had helped them in their time of need. From then on, the village became an example for others, demonstrating that access to healthcare is essential for the well-being of individuals and communities. The village became a place where people could get the healthcare they needed, and it served as a reminder of the importance of investing in healthcare systems around the world. Just like the story in our today's world, there are several existing challenges when it comes to accessibility and better healthcare systems, including cost. Healthcare can be prohibitively expensive for many people, particularly those without insurance or who are underinsured. Geographic barriers. People living in rural or remote areas may have limited access to healthcare facilities and providers. Lack of healthcare providers. There is a shortage of healthcare providers in many parts of the world, particularly in developing countries. Health literacy. Many people have limited health literacy, which can make it difficult for them to understand and navigate the healthcare system. Health disparities. Certain populations, such as racial and ethnic minorities, may experience health disparities due to social, economic, and environmental factors. Outdated technology. Some healthcare facilities may lack modern technology and infrastructure, which can limit their ability to provide high quality care. Fragmentation of care. Patients may receive care from multiple providers and facilities, which can lead to fragmented and inconsistent care. Addressing these challenges will require a comprehensive approach that involves improving access to care, addressing social determinants of health, investing in healthcare infrastructure and technology, and promoting health literacy and patient empowerment. It will also require collaboration among healthcare providers, policymakers, and communities to develop solutions that are effective, equitable, and sustainable. AI and robotics have the potential to help mitigate some of the challenges facing healthcare systems and improve accessibility to better care. Here are some specific ways in which AI and robotics can help. Diagnostics and personalized treatments. AI can help doctors analyze large amounts of patient data to make more accurate diagnosis and personalized treatment plans. This can lead to better patient outcomes and reduced healthcare costs. Predictive analytics. AI can help insurance providers predict which patients are likely to develop chronic conditions or require expensive treatments in the future. This information can be used to develop more effective and efficient care plans. Robotic surgery. Robotics can assist surgeons with minimally invasive procedures, which can reduce recovery times and hospital stays for patients. Telemedicine. AI powered chatbots and virtual assistants can help patients get medical advice and schedule appointments remotely, which can improve access to care for people in rural or undeserved areas. Fraud detection. AI can help insurance providers detect fraudulent claims by analyzing data and identifying patterns of fraud. Cost. AI can help healthcare providers optimize their operations, reducing costs and improving efficiency. For example, AI can be used to predict which patients are at high risk of readmission, allowing providers to target interventions to prevent readmissions and reduce costs. Geographic barriers. Telemedicine and telehealth technologies powered by AI can help to overcome geographic barriers to care. For example, remote consultations with AI powered chatbots and virtual assistants can provide access to medical advice and treatment for people living in rural or remote areas. Lack of healthcare providers. Robotics can help to address the shortage of healthcare providers by automating routine tasks and assisting with complex procedures. For example, robots can assist with surgeries, allowing surgeons to perform procedures more efficiently and with greater precision. Health literacy. AI powered chatbots and virtual assistants can provide patients with easy to understand information about their health and healthcare options. This can help to improve health literacy and empower patients to take an active role in their healthcare. Health disparities. AI can help to address health disparities by identifying and addressing social determinants of health such as poverty, housing instability, and food insecurity. For example, AI can be used to analyze patient data and identify at-risk populations, allowing providers to target interventions to address social determinants of health. Outdated technology. Robotics can help to modernize healthcare infrastructure by automating routine tasks and improving the accuracy and efficiency of procedures. For example, robots can assist with diagnostic imaging, allowing providers to identify and treat conditions more accurately and efficiently. Fragmentation of care. AI can help to improve care coordination and reduce fragmentation by providing healthcare providers with a unified view of patient data. For example, AI can be used to analyze patient data from multiple sources and provide providers with actionable insights that improve care coordination. Overall, AI and robotics have the potential to improve healthcare accessibility and mitigate some of the challenges facing healthcare systems. However, it's important to ensure that these technologies are implemented in a responsible and ethical manner to protect patient privacy and ensure equitable access to care. Thank you.